749, our community partner this month on all the Journal Broadcast Group stations is St. Elizabeth's Health Care Center, and we're very happy because Sister Janet Sue Smith, who's the program director and volunteer coordinator, dropped in to say good morning.
Good morning, everybody.
We're glad to have you here, and it's one of those things, St. Elizabeth sounds like something everybody would know about because it's so familiar, the name is so familiar sounding. But what you do is pretty unique. Tell us about it.
St. Elizabeth's has had the fortune to be here for over 50 years. We're celebrating our 50th year this November. Many people know us in the community as St. Elizabeth of Hungary Clinic.
That's right.
We provide medical and dental services on a sliding fee scale basis for those people who fall through the cracks of the healthcare system.
Mm-hmm.
So a lot of the persons that we see on a daily basis are people who have been knocked in and out of systems, who've lost a job, moved on to a new job, they have their own business, don't have benefits at their work site, whatever. There are a variety of reasons why people don't have insurance.
What kind of dentist do you go through? Do you have your own, or is there people in the community who donate their time to you, or how does that work?
The volunteer dentists are our major partners. They work for us both in the clinic, donating their time, and then those who are in more specialized areas will see our patients in their offices so that they have access to their own equipment and services and their staff. Dentists are a major need right now. We need more volunteer dentists who would just give 4 hours a month. We're happy we put those pieces together.
I would imagine it's the same story for the medical doctors that you have, not just the dentists. Is that correct?
Exactly, except they're not looking at teeth as much as bodies.
Yeah, sure. And is it emergency only or also preventative care?
Actually, not emergency. We're not set up to be an emergency service site, though we are able to get people usually in within 24 hours to 48, as long as it's not a weekend. Of course, if they come in the door to deliver the baby, we kind of call 911 quickly. Mm-hmm. But other than that, our medical doctors, our volunteers are great and provide the bulk of the services in our health center.
So speaking of volunteers, other than professionals like the dentists and the doctors, what other kind of help? Is there a need for just general people from the community to help you out?
We see volunteers on a regular basis come to us from many aspects of the community, from young to older. We have students who approach us because of student projects. We have college students who approach us who are either pre-med or pre-dental.
Oh, sure.
And then we also see older adults who usually come to us frequently after their retirement time. So most of our volunteers get involved in providing supportive services for the staff. We also write lots of grants in order to sustain our services. And so the students get involved in doing research for those grant projects and also in helping us put those into place in the community.
Have you seen just an overwhelming increase in the need for your service with the changing dynamics of access and people's ability to be insured or not be insured?
We have increased numbers coming to us. The problem is people have difficulty in paying for any kind of medical care out of their pocket. But when you don't have resources, finding our discounted care is usually very welcomed by the clients who come to us.
I'm curious, do people come to you directly or are they referred to your services through
someone?
Yes,
to both.
Okay.
Often we have prescription assistants, so they may be referred by the local pharmacy where they couldn't pay their bill because they were in the emergency room over the weekend, got a script that was much higher than what they could afford. So the pharmacy know that we have prescription programs and will refer the clients over to us. There are some people who will refer to us from their offices, but most often the doctors will try to see the patient once or twice, but then they refer them on to us for ongoing medical home.
And St. Elizabeth is on our website, mixfm.com. You can click on the link to get any more information. Is there anything that you want us to bring up that we haven't?
I just think St. Elizabeth's is a well-known secret in the community. I usually can do presentations to any group, and there are always a large number who have received care from us already. I would just ask people to remember that we need donations to keep going, and we welcome any offering of services and of money to help us continue our mission to provide care for the uninsured.
Sister Janet, thank you very much for sharing the information about St. Elizabeth, and again, it's on the website at mixfm.com.
Thank you, Journal Broadcasting.